Hi, this is Dr. Mark Holthouse and Tom Malterre, and we're coming to you from the Functional Medicine of Idaho. Tom's involved with nutritional education, and I'm their current medical director. And what we wanted to do today was talk a little bit about some of the hype and anxiety that's come up over this crazy virus and expand a little bit about what we've been doing. We've been busy kind of digging through the literature that's out there, which is very sparse because this is so new, looking at options for natural ways to go about this, treating, prevention. You know, there is no cure. And hopefully we're going to come up with some things here shortly that can really help slow this disease down. But until that time, our purpose is to let you know, as Functional Medicine Idaho, you know we've done functional medicine, which is all about root cause. We also do primary family practice. What we're wanting to offer now as well is acute assessments where we can actually help people through this minefield of questions and what to do if they develop symptoms. We've been really on it looking at the detailed data that's been published, and looking at options for how to deal with it from a natural perspective can mean so much more than just drugs that really we don't have anything proven yet. So lifestyle becomes a big, big deal, which we're experts at and enjoy talking to patients with on a daily basis. So Tom's going to talk to you in a minute about how to engage the clinic and make this happen, kind of next steps. What we do know is that there are some really cool things going on in China as far as 3 studies currently going on using IV vitamin C. And this is just one of the things that's been found to be quite effective, not just for prevention, but possibly for treatment. And so we're going to be offering IV vitamin C here, and it's going to require coming in and getting to know us, having an interview, and then figuring out how to do this in the most safe way for both our staff and you as a client. I want to give the microphone over to Tom, and he's going to tell you a little bit about the different types of visits and some of the details.
Absolutely. Thanks, Mark. So initially what you can do is you can come in and you can do a 30-minute acute care. So now normally we have a 4-month plus wait list for everybody, and we're going to make some spaces with our primary care team. So if you are coming down with symptoms and you're quite concerned and you want to talk to somebody, you can do telemedicine visits with us. You don't have to come into the clinic. You can discuss directly with our primary care team, including Dr. Holthouse, and you can have an assessment of what to do next. We're also setting up group visits, and these group visits are to address multiple different things. Number one, we're going to address if you have the comorbidities. So the primary things that people are suffering most from when they get diagnosed with the COVID-19 is they're suffering from adverse events if they have hypertension. They're suffering from adverse events if they have diabetes. So we're going to talk to you in group visits. We're going to have these small group visits, 4 to 5 people, where we're going to educate you on what you can do to lower your hypertension, to lower your diabetes risk. So if you do contract the coronavirus, then your outcomes are going to be a lot better. You're going to get better faster, and you're going to have less adverse events or side effects from the disease. Now, above and beyond that, we're doing group visits for immune education. So we're going to talk to you about lifestyle. We're going to talk to you about supplements. I've been diving into literature for days and days now, so I can tell you exactly what the research says. There are some new trials coming out showing some positive stuff on COVID, on what you can do to change your immune system. We're going to talk about certain medications you might be on that may or may not put you at more risk. And we're just going to list research. Hard data, scientific research that's coming out of trials in medical institutions that show you what you might be at risk for. So let us educate you, let us calm your fears, and let's empower you to take some steps to let yourself know you're in charge of your own health and you can do something about this. You don't have to just sit in quarantine at home and worry, worry, worry. You can get busy, you can take some actions, and hopefully keep yourself healthy during these times.
Great. Yeah, because we all know stress just messes up your immune system anyway. So give us a call. The phone number at Functional Medicine Idaho is 208-385-7711. Or you can go to the website, which is kind of a fun name, no pun intended, www.funmedidaho.com. And let us help you and hold your hand through this confusing time. Thank you very much.